know what the forward thing is. I don't know how to get this. There we go. What you have a question about later? I mean, not later. Later.
Just, I don't know, like all of it confuses me. Like the difference between the like extrinsic and then intrinsic, and then like what, I don't know, all of it.
So with the clotting factor, with those clotting factors, they all, I told you they're coming from the liver, right? So the liver is producing all these factors that are used to form a clot, right? Within those stages, you have the vascular spasm, right, where your vessels are constricting. You have your platelet plug formation, to where now your platelets are coming to the site of injury, right? And now the issue that you was having or having confusion about was the glue, right?
Right.
You have a platelet and it's plugged, so blood loss is stopped, right? But you still have blood flow coming through. So eventually, if your blood flow is continuing, I mean, those platelets will eventually kind of pop up. So you want to seal the deal. That deals with those clotting factors. So there are two different mechanisms in order to seal a clot, because like they'll tell you in clinics, like sometimes clots can form just randomly, right? But without the coagulation or that glue, right, you really won't have any kind of detriment. So it's a lot of cascades of activation, right, to making sure that your body just don't have an appropriate clot. So the first one was, would you say you was confused about just the different pathways?
Yeah.
Okay. So you had two different mechanisms of control, right? You have intrinsic, extrinsic, and intrinsic, right? Y'all can follow along, but y'all don't have to. Just make sure we'll get that Monday. But you have intrinsic and extrinsic, right? Extrinsic is where you have this platelet plug. Within this platelet plug, there's this tissue factor that's pretty much telling the clotting factors, hey, I've done my job. Now I need you to activate yourself, right? So one of the clotting factors, the first one was 7. Remember that one? Right? So based off the tissue factor, it's activating 7. Right? That is your only clotting factor that's based off of the extrinsic pathway. Got it? Right? So what we're looking at is just ways of activating the glue, manufacturing it. Right? So extrinsic dealing with the tissue factor. Right? The intrinsic is dealing with like the direct contact to those tissues. In which you have those clotting factors that was important for that, right? You're starting out with 12, right? Based off of direct contact, you have 12 that's leading into activated 12, and that's going to activate what? 11, right? Right. 11. And then 11 is going to activate 9, correct? So, from those two pathways, right? From the extrinsic, you had 7. From the intrinsic, you have 9. But also, there are two other clotting factors, or clotting factors that was produced by the liver, which was what? 5. And what else?
8.
Who?
8.
And 8. All right. So all 4 of those clotting factors have already been activated. So now your mechanism is like, hey, now I can activate this common pathway, which we're activating what factor now? 10. Right? So each one of these, plus the use of calcium, right, is going to activate factor 10. This is your common pathway now. So you have 2 different mechanisms in order to activate 10, which can now lead into the pool coagulation. So, how do you clear this? Oh. No, it's okay. I mean, there we go. All right. So you have 10 that's activated. Right. Now you need to activate these inactive, what we call zymogens. Right. So the first one was prothrombin, which is activated into thrombin. after you activate Drummond, now you have to activate one more piece of information, right? Which fibrinogen, which is inactivated. Fibrinogen into fibrin. Right? Fibrin is that main substance that's going to seal the clot after your actual clotting or platelet plug formation. So what you're just looking at is the mechanism in order to get the glue to seal the clot to allow the repairing of the vessels.
Okay.
That's just, you're just looking at the mechanism. That's just the mechanism of what's happening. Yep.
Would you put any medicines on there?
We will talk about it. So next week, I think next Friday, I really gonna need y'all to like look at the medication because they're really gonna have issues probably with that, like the anti-clotting, warfarin, heparin, that will be needed for y'all to make sure y'all get to them for next Friday.
Okay.
Yep. Because I didn't get to the subtle people yet to get to this region. So next Friday for sure, because next Friday leads into their test of the following week. Yeah, so it'll be a big review of 17, 18, 19. Yeah, and that'll be for both Dustin's class, my class, and the consultant class. Yeah.
So what do we have to know about this for the test? Like, do we have to know the order or just?
Probably, yeah. If you know the order, it's gonna help everything out. Everything goes out. Yeah. No other questions? No. Everything is covered on there? So far, so good?
Y'all good?
Y'all good? Be sure there's no other questions that y'all might have concerns about. Y'all still have them in the group meeting, right? Ask them
Yeah,
questions.
y'all can ask us questions.
They're at your leisure. Like,
Is that the little inbox you sent?
with the link to get into their group meeting.
I
Yeah.
didn't know what that was.
Yeah. They're more than welcome. They've already told me that they're more than welcome to do like Zooms, or if y'all need to have questions or whatever, like they are at your disposal. Yes. Yeah, because everything that I'm teaching you guys, I'm literally handing it off to them, making sure they refresh, and then they'll tell you exactly what the test was going to be covering on, like things of that